Hello and welcome to today's presentation on health services and requirements. My name is Minnie Ho and I'm the lead communications officer for Campus Health. Our organization is led by our chief health officer and vice president for Campus Health, Dr. Sarah Van Orman. During the live presentation, I will be joined by our colleague Mallory Waite-Shaw, who is our leader for patient access, and she will be sharing information in more detail about how our teams work together to take care of your health. With that, let's get started and we'll dive into some requirements and some highlights of how you can use health services. Let's start with some basics. So when you are a USC student on campus, student health will become your home for healthcare services. You are the center of our care. We will be right here on campus to provide your medical care services, mental health support, and short-term therapy services, as well as prevention education and workshops. There are no co-pays for these visits and programs. There's no insurance utilized for these services. These services are paid for by the student health fee. This is required for all on-campus degree students to participate in. The current fee is $650 per semester for fall and spring. Health insurance, which we'll dive into in following slides, is a separate requirement, which we'll talk about in the next sections. We administer a campus student health insurance plan, which we call SHIP, provided through Aetna. The SHIP Aetna plan is designed to make sure any costs that are related to additional needs beyond our in-house services will be covered. Our in-house services include medical care with on-site radiology and lab services to make diagnosis faster and easier for our patients. We also have the most robust mental health services among colleges in the United States, with more than 60 therapists dedicated to student support and short-term therapy. It does not matter which insurance plan you are on, whether you are choosing to have SHIP Aetna or another plan that you bring to campus, these services are all available to you. Our teams offer in-person services 6 days a week and telehealth support 7 days a week during the academic year. If you're an undergraduate student, it's more likely that you'll be going to the Engelman building on the University Park campus, also called UPC. If you are a graduate student in dentistry, graduate liberal arts, social sciences, humanities, arts, or the professional schools, this will also be your main location of service. If you are a student in the Keck School of Medicine, the Mann School of Pharmacy, the PT or OT programs, or the PA program in Alhambra, the Eric Cohen Center located in HC1 of the Keck Medical Plaza will probably be your primary location of service. The Engelman location is open from 7 until 7 p.m., Monday through Thursday, and on Fridays until 5 p.m., with half-day in-person availability on Saturdays until 1 p.m. Telehealth is available on Sundays as well as throughout the week. Our phone service is 24/7 for students who need advice nurse consultation or are experiencing mental health crisis or need to talk to a confidential advocate. These services are all available through one single number, which is 213-740-9355. It spells well for the last 4 digits. So our medical team includes more than 50 providers and includes specialists in dermatology, allergy and immunology, gynecology and sexual health, physical therapy, and registered dietitians. All of our medical providers are credentialed through the Health Systems Organization of the University, Keck Medicine of USC. And many providers are clinical faculty physicians in the Keck School of Medicine of USC. We also work in partnership with the USC pharmacies for travel vaccinations, prescriptions, and other pharmacy-related services. The pharmacies are located next to the health centers on both campuses. This slide shows some of the common in-house services that students use, including acne treatment and dermatology, allergy desensitization, physical therapy, and definitely illness and injury care. For students with symptoms, we have same-day appointments as well as next-day morning appointments for students who are experiencing symptoms during the overnight hours. We also offer a range of sexual and reproductive health services, as the majority of the student population are entering or already in their sexual and reproductive health years. Screening services like pap smears, which start at age 21 for optimal cervical health, family planning and contraception services, STI testing and prevention services, these are all available through Student Health. Our counseling and mental health teams offer a range of options to connect with a counselor, whether it's on-site therapy services within the academic buildings and cultural centers, or a non-clinical conversation called Let's Talk. These are 30-minute blocks that are offered multiple times every week. All of these programs and services are available to our on-campus students. In order to start accessing these students when your program starts, there are a few things you will need to take care of before you arrive. All of these steps can be taken care of through the Student Health Records portal, which is called My SHR. You will log in using your USC Net ID, which you can activate through USC IT services. Once you have a Net ID, you will use this login to get into all major systems at USC. Do not share this login with anyone, even members of your own family. Family members can help you in putting together the next steps, but the login should be kept private only to the student. So over time, your health record information will contain information that you might want to keep private from anyone else, and this ensures that you can have a confidential and private conversation with your providers. That really makes the healthcare relationship much more beneficial for the patient or the client. So first step, there is a consent for treatment form. So if you are 18 or older, you can sign this and do the consent on your own. If you are not yet 18, you will need a third-party consent form, which a parent or guardian can complete for you, and you can upload into MySHR. So the second important thing that you will need to do is you will need to gather all your immunization records, which might be in your current health records portal, or it might be a paper record. You can download it, take screenshots, and then upload these to the MySHR health portal. If you do not have a complete record of your immunizations, there is a form that you can download and have signed by a medical provider to verify your vaccination history. So the third step involves health insurance and is both a healthcare and a financial decision. So this might be made with your family if you are currently under a parent plan or in some cases a spouse's healthcare plan. All students in campus degree programs are required to have health insurance. You will automatically be enrolled in the student health insurance plan, SHIP Aetna, but if you have a comparable existing plan with the coverage that is required, you can choose to use your current plan and waive out of SHIP Aetna. Typically, for students, they might waive if they're on a parent's or spouse's plan, if they have veterans' health benefits, or if they are on Medi-Cal. If you are deciding whether you want to keep the SHIP Aetna plan, here are some very important considerations. Number one, review your current plan to make sure there is a strong local network of provider coverage in California. If your plan is related to a health system primarily in another region of the country, you may not have an extensive network in the LA region. So check your current plan to see which providers that are available in the Southern California region. This is usually available on your plan's member website. Number two, reputable history. There are a wide range of smaller insurance plans. Very often these plans are marketed to international students. These plans might seem attractive because they have a lower premium payment. In other words, what they charge you monthly may seem very low. They may even offer incentives for signing up, like free mobile phones. However, many of these plans do not provide the extensive coverage that you might need when you need to activate the use of your health insurance plan. Or they might require a high portion of the payment from you as the member. This is called meeting the deductible before they will pay out to cover your health costs. So, if you are an international student and you do not have an existing plan in the US, such as Blue Cross, Blue Shield, Anthem, United, Kaiser, Medi-Cal, etc., we strongly recommend keeping the SHIP Aetna plan, as it is really designed for great coverage in California as well as throughout the rest of the United States. It is a national plan with a very strong national network. And if you are signed into SHIP Aetna, it can be used anywhere in the country 365 days of the year, as it is a year-round plan. So the combination of the student health fee, which we call SHIF, and the student health insurance plan, which we call SHIP, provide great total coverage for students. SHIF, the student health fee, gives you the ability to use all the medical and mental health services of USC Student Health with no copays per visit. SHIP, the health insurance plan, covers extended additional health care, including prescription coverage, vision care, lab tests, urgent care visits, specialists, hospital care, etc. Copays may apply, such as $10 for psychiatrist appointments at our in-house, on-site psychiatry and behavioral health services practice, and $50 for visits to urgent care. Other services, such as flu shots, Narcan, and other preventive care, have a $0 copay. When you arrive to use services at Student Health, you will be greeted with warmth, respect, and care. We use what we call the CARES model. It stands for Connect and Communicate, Ask, Repeat, and Exit Strong. This means members of our team will connect and communicate with you as a person. We'll ask questions so we may correctly understand how we may help you today. We'll repeat back to you to make sure that we understand, and we will exit strong to make sure you are connected to the next step needed, whether it's directions to the pharmacy, a follow-up appointment, or making sure you have instructions for monitoring your health. One of our best options for students is to know about is the Advice Nurse. This is a service that is available by phone 24/7. It's also available by secure messaging in the MySHR portal. So some of the things that we can answer for you are if you're having respiratory symptoms and you're not quite sure what to do next. We get some questions about animal scratches, insect bites, unusual allergies, upset stomach, and questions about, which immunizations you've completed and which you might need to complete. So outside of appointment visit hours, which are typically Monday through Saturday with telehealth on Sunday, if you need to be seen for immediate medical care, there are options. In the event of an emergency, dial 911 or the Department of Public Safety, which is 213-740-4321 at UPC. At HSC, the DPS number is 323-442-1000. If you need Advice Nurse consultation, you can call the WELL number, 213-740-9355. Now, beginning July 2024, a student health representative will be answering the calls 24/7. So medical teams will be available for virtual consult until 9 p.m. and for urgent care on call after 9 p.m. Advice Nurse is available 24/7. Counselors and confidential advocates are also available for urgent matters through the 24/7 line. Confidential advocates are available 24/7. So, if you need in person medical evaluation and treatment, there are nearby options if the services at Student Health are closed. You can go to Optum, Exeter, and Reliant Urgent Care Centers. Exeter Urgent Care in Culver City is open until 9 p.m. 7 days a week. The copay on SHIP is $50. If you need an emergency medicine department, PIH Good Samaritan Hospital in downtown LA is a recommended resource. Let's talk about your emotional well-being and college life. Starting college is a combination of moving to a city, starting a new school, having new people to live with, and all in a new home. It's also, for some of our undergraduate students, a completely new experience of navigating daily decisions on your own and also not knowing your way around. It's a lot to get used to. There are going to be waves of heightened excitement and slower period when doubts, uncertainty, boredom, or loneliness might emerge. And this is all very, very normal. So, social comparison is a concept of describing the need to figure out who I am in relation to other people. And it's a part of being human. Because most of us exist in the digital social world as well as in real life, our sense of self can often extend to what we're seeing on Instagram, TikTok, and other posting platforms. When scrolling through posts, it might seem like, oh, everyone's doing much better than I am, or everyone's having so much fun and I'm not a part of it. This can be a distortion from reality, like looking in a funhouse mirror. In truth, when students arrive at college, everyone's new and everyone has moments of doubt. That part just doesn't necessarily get posted to socials. So, one of the resources we've made available to students is the Nod app. It's free and it has been selected by our expert providers in counseling and mental health services. And it has tools and practices that can help students make inroads to forming friendships and authentic connections. So it's free. We encourage students to download it, check it out, and hopefully this can help kind of ease some nervousness or shyness or any blocks that you might have in trying to reach out and make new friends. Speaking of counseling, we have a very robust mental health team, several of whom have offices on site in the academic school buildings and in the cultural centers. This makes it convenient for many of our students to access mental health services without having to go too far from where they normally spend their days. One of the ways to get familiar with services from CMH and get a sense of how counseling and mental health can support you is to schedule a Let's Talk appointment. This is considered a drop-in. It's 30 minutes, it's non-clinical, so it doesn't require intake paperwork, and it gives a student a chance to talk about whatever is on their mind. It can provide relief when something is stressful, or you're just looking for a new perspective to problem solve. Several Let's Talk drop-ins are scheduled every week with a range of therapists of different backgrounds. Check it out. Two student well-being resources that we also recommend that you check out are Staying Well. So the address is stayingwellat.usc.edu. It is an article site and it contains lots of great advice for college students on roommate negotiation, nutrition, exercise, relationships, and other health and well-being topics. All of the materials are selected